Hello. Today we look at prematurity. In the last discussion, we're looking at low birth weight, prematurity, and post-maturity. So right now, we're looking at prematurity as a separate condition in our pediatrics. Okay, so presentation is by Mr. Jones. That is my name. Okay, so presentation is by Jones or Mr. Jones. You can call me. All right, and let's look at the introduction of our lesson. Prematurity, especially if extreme, is the greatest single cause of problems and death after delivery. Some of the infant's internal organs may not have developed fully, putting him or her at greater risk for certain disorders. Why an infant is born prematurely is not usually known. However, the risk of premature delivery is higher in unmarried women and those who have low income and poor education. So, having inadequate prenatal care, poor nutrition, or untreated illness or infection during pregnancy also puts a woman at high risk of a premature delivery. For reasons not known, black women are more likely than women in other racial groups to have a premature delivery. So a premature baby, by definition, is one born after 28 weeks of gestation but before 37 complete weeks calculated from the first day of the last normal menstrual period. And I've kept on saying it's important we note the parameters here when you're saying premature baby is 28 to 37 weeks calculated from the last normal menstrual period. But otherwise, before 28 weeks, the fetus is considered not to be viable and cannot survive even if it were to be incubated. Of course, this scenario may not be the same depending on the development level of care in the country. So the normal gestation period, of course, is 40 weeks, and the average birth weight of a normal baby at 10 is 2.5 kg. So prematurity is a condition when the baby is born after 28 weeks of gestation, but before the 37 complete weeks, regardless of the birth weight calculated from the first day of the last normal menstrual period. Let's now look at the factors that are predisposing to prematurity. So, as earlier stated, the actual cause of prematurity are not known, but there are some predisposing factors. So, for descriptive purposes, the predisposing factors are grouped into maternal and fetal causes. If you have watched our lesson on low birth weight, prematurity and post-maturity, you see that we added in a lot of predisposition to our list. So, maternal factors. General ill health of the mother during pregnancy can predispose her to a premature delivery. Some of the conditions which can lead to premature delivery include heart disease. The mother has an pre-existing heart disease, she may end up having a premature baby. Hypertension, which causes or leads to eclampsia. Diabetes mellitus. Renal failure. Cervical incompetence. Placenta previa, placenta abruptum, uterine fibroids, several maternal illness like tuberculosis, infections like urinary tract infections, cancers, and the already mentioned diabetes mellitus and hypertension, all of them they will predispose to premature baby. Because these conditions, we are saying they're affecting with the metabolic process of the baby. And when you talk of multiple pregnancy, it's all about the competition for space. Hence, the baby will come out early because of pressure within the uterus. So, worm infestation, which may also lead to anemia and thereafter a premature delivery, can also be considered. And febrile diseases like malaria also lead to prematurity. Polyhydramnios, which is an increase in the amount of amniotic fluid surrounding the fetus, which usually occurs in the third trimester and may be associated with maternal diabetes or multiple pregnancy and fetal anomalies causing impaired swallowing or placenta abnormality. So polyhydramnios may lead to prematurity. So maternal age, we said should be between 20 to 25. Any outside this leads to low birth weight. So maternal age, that is outside the optimum childbearing age, which is estimated to be between 16 to 35 years. Of course, 20 to depends on the documentation that you are reading. So we are talking of 16 to 35 years. Other books, they are going to stress that. So a young girl's reproductive system is not fully developed to handle celiac, hence ends up with a premature baby. If the baby is too old, the same may happen if the mother is too old, the same may happen due to reduced levels of hormone production. Having your first child after 35 years or having a child after 35 years, there's hormonal imbalance. Having a child before 16 years, okay, so the hormones are not yet balanced, so you may end up having a premature baby. So now let's look at fetal causes. Rhesus factor incompatibility with the mother may lead to prematurity. Congenital malformation, including intrauterine growth retardation, multiple pregnancy, for instance, twins, triplets, and the likes. Intrauterine fetal infections, e.g., rubella, syphilis, and creoammonitis. So other factors here include socioeconomic factors, of course, that is maternal malnutrition may lead to prematurity. Higher percentage in those of low income class, though it is low in those women of high socioeconomic group. Trauma, for example, a direct blow on the abdomen may also lead to prematurity. Psychological stress may also lead to prematurity. Chronic smokers and drug abusers also tend to have premature babies. In women who take alcohol or alcoholics or alcoholism in pregnancy may also lead to prematurity. Placental abnormalities, that is, if it is small or it may not have adequate nutrition, hence it also leads to prematurity. Physical characteristics of a premature baby. So preterm babies are immature and not ready to adapt to extrauterine life. The characteristics of preterm babies are related to gestational age. So the head larger in proportion to the body and has a triangular face with a pointed chin and a worried expression. Okay? If it is very small, it may be reluctant to open eyes. Cartridges on ears, thin and pliable. Sutures and fontanelles are widely spaced, and the skull bones are very soft or quite soft. Other physical characteristics, when you look at the skin, the normal color of a baby is pink. So a premature baby will appear darkish red in color, owing to the absence of subcutaneous fat. Surface veins are prominent and covered with varying amount of soft hair, which is known as lanugo. Vernix caseosa, this is a whitish, creamish substance. Okay, a baby is born with. A premature baby is born with little Vernix caseosa. It is minimal at 28 weeks and more at 36 weeks. Then it diminishes thereafter. Talking about reflexes as part of the physical characteristics, we can say a mature baby will have all the normal reflexes at birth. So in a premature baby, the reflexes are either very poor or absent. For example, more reflex or so-called move reflex. A mature baby will raise its arms when frightened. Okay, move reflex. That is, a mature baby will raise its arm when frightened. When we talk about the plantar reflex, a mature baby will be able to flex the foot when rubbed or stimulated. When we talk of the swallowing reflex, a premature baby will not have the swallowing reflex, or it may be very poor. When we come to the chest, the chest is small and narrow, and its circumference will be reduced. Breast tissue not usually palpable before 34 weeks. To do with the abdomen, it will be large and often appears distended. Umbilicus appears to be body set. For the genitalia, it will be small. In females, the labia majora does not cover the labia minora, and hence the labia minora becomes more prominent. In males, testes may not have descended into the scrotum and may be poorly dropped. Okay, may be poorly dropped, and they have few lugae, that is the skin fold. The testis descends into the scrotum towards the end of the third trimester. Physical characteristics. Muscle tone. The muscle tone is poor. The more immature the baby is, the greater the degree of extension of the arms and legs. The baby may appear feeble and drowsy. Sucking reflex is poor or may be absent. So at 28 weeks, baby weigh about 1 to 1.25 kgs, and length is 37 centimeters. At 36 weeks, it weighs 2.25 kgs or 3 kg, and length is about 47 centimeters. So the cry is feeble and poorly sustained. The position is frog-like. At 28 weeks, the infant is hypotonic. At 32 weeks, flexion is present in the lower limbs, and 36 weeks, all limbs are flexed. Alright, so we continue again with the physical characteristics here now looking at ears. Okay, so the normal pinna is cartilaginous. The normal shape occurs at the 32nd to 34th week of gestation. So in a premature, pinna is soft, flat, and shapeless because the cartilage hasn't fully formed. Talking about the nails, they normally appear at 20 weeks of gestation and grow up to cover up the nail bed. In a premature, the nail bed may not be completely covered. Okay, ranugo or hair. Before the child is born, after 20 weeks, the baby has a lot of hair called lanugo. So this usually disappear after the 20th week. A premature baby has a lot of ranugo. Let's now talk about plantar creases. In a normal infant, there are wrinkles on the sole of the feet, which are called plantar creases. So these normally appear at around the 2nd week of gestation. In a premature baby, the sole is very smooth. There are no wrinkles. Nipples. In the mature infant, the nipples are present at birth. Areolar tissue formation starts around 34 weeks of gestation. In a premature baby, nipple formation may be incomplete or very small. Alright, so what would be the nursing problems of premature babies? So, number one is hypothermia, which is due to inadequate adipose tissue. Number two is feeding due to lack of swallowing reflex. Number three, respiration due to altered respiration due to incomplete development of respiratory center. As such, there will be apnea and bradycardia. So, number three, we are saying there's altered respiration that is due to incomplete development of respiratory center. Hence, we see apnea and bradycardia. So, risk of infection or to do with infection, number four, we are saying the babies are prone to infection because of their immune system, which is not fully developed. So, other problems include jaundice, which is due to excessive breakdown of red blood cells because the liver is not fully developed. Hence, there is what is referred to as physiological jaundice. The sixth problem the baby may have is bonding to promote mother to child bonding. So it may be difficult because the baby will be required to be in the incubator most of the time. Alright, so respiratory distress syndrome, this is due to lack of surfactant, a chemical substance produced by the lungs, and prevents pulmonary collapse. So we have already covered hypothermia, hypoglycemia, and the likes. So now we are now looking at nursing management of hypothermia. Okay, which is one of the problems that we may see in these patients. Where the baby is born, the temperature drops, but it turns to normal after 8 hours. The baby is at risk of hypothermia. Okay, we need to know that when the baby is born, the temperature drops, but it returns to normal after 18 hours. So the heat regulatory center is also not well developed. Hence, there is need to keep warm by keeping it in the incubator. Okay, the baby can also be kept warm by covering it in warm linen. Keep room warm by use of heater 20 to 24.4 degrees Celsius. So the room should be well ventilated and humidified. Okay, this should be humidified between 44 to 55%. If the baby is born at home, care should be taken not to burn the baby by use of a hot water bottle. Okay, if you're using the hot water bottle for warming the baby or something like that, it may spill. So extra care needs to be observed. The required temperature is 46.1 degrees Celsius, and the bottle has to be tightly closed and wrapped in a cloth. Of course, that is the way it's done. I'll post a video that will show how to use the hot water method. Okay. Electric pads should not be used to avoid electrocution of the baby. So now, use of incubator. So it is most suitable method of nursing premature babies. It must be regulated between 26 to 20, to approximately 28 degrees Celsius. So the temperature must be checked regularly. Advantages of using the incubator is that it has a temperature regulator, it has an oxygen controller, and there's optimal humidity controller within. Also, the other is that the baby can be weighed just there within the incubator without necessarily disturbing the baby. But otherwise, the point to note here is that the color of the face will tell whether the child is cold or hot. So if flushed, it may indicate overheat, while pallor will indicate that it is feeling cold. Feeding the premature baby. So sucking and swallowing is a problem since reflexes are either absent or very poor. So food placed in its mouth may choke it. It may vomit, okay, and have abdominal distension or even respiratory distress. So a premature needs about 60 to 80 calories. It needs adequate proteins, carbohydrates, and fluid intake. So no fats, give skimmed milk for it has low fats. Okay, this is because digestion in a premature is incomplete, so the enzyme system is immature. Vitamin C is also needed to metabolize phenylalanine and tyrosine. Vitamin D is needed because the child loses vitamins in the stool, and iron is also required. Methods of feeding. You can use gavage, it is used when an infant is unable to suck, so swallow, or in those infants who become tired of sucking. There are basically two types of gavage. Catheter is used through the nose to the stomach. That's what we call nasogastric tube. And catheter is passed through the mouth. So total intravenous alimentation. It is used when feeding by mouth is impossible. So it is used when feeding by mouth is impossible. The baby is fed intravenously with an IV line in situ. Calories, vitamins, and electrolytes are given to sustain growth. Effects of intravenous feeding may include sepsis, dislodgement, thrombosis, and metabolic complications. Feeding with medicine dropper. It is used in those with good swallowing reflex but cannot suck. the tip of the medicine is dropped. Okay, the dropper is protected with soft tubing at the ends. A few drops at a time are given. Bottle feeding or feeding by cup. Bottle feeding or feeding by cup. So this is used in those premature babies with strong sucking reflexes but get tired easily. Expressed breast milk is put in a cup and given to the baby, and the cup should be held during the entire feeding. Prevention of infection. So types of infection: gastro infection, so intestinal tract infection or diarrhea due to improper handling of the feeds or nasogastric tubes. So infections have to be prevented with the GIT in that sense. Then skin infection due to dirty hands or stuffs and other dirty linen or mother. So remember to wash hands before touching the baby and after touching the baby. Respiratory infections, these can be from stuffs or nursing the infants. So cleaning and frequent change of nasogastric tube is very important for infection prevention. Staff should also wash hands, use barrier methods when attending to the premature infants. People or staffs with respiratory tract infection should not be allowed to enter the nasal units or any other infection, but more especially the respiratory tract infection, because the baby may catch this infection. Regular cleaning of the incubator is important. Almost every day, the incubator needs to be cleaned, or it will depend on your policy. Top and tail to remove dead cells on the body can also be done in order to prevent hypothermia, and administration of prescribed antibiotics is also very important. Okay, so now let's look at initiation and maintenance of respiration. So the respiratory center of the newborn is immature. Hence, we are saying the alveoli of the lungs contain little or no surfactant, and the diaphragm and intercostal muscles are weak. Surfactant is a complex mixture of compounds that are secreted by the pneumocytes 2, that prevents the alveoli of the lungs from collapsing by reducing surface tension. Surfactant is directly introduced into the alveoli. Okay, so let's talk about drug therapy. What drugs can be used? Administration of glucose through nasogastric tube to stimulate liver cells. Phototherapy, treatment by means of a blue light, which helps to oxidize the bilirubin in the skin, hence relieving the jaundice. Vitamin K can be given to prevent breathing tendencies, and oxygen therapy also may be given to the patient if they are having apneic spells. Administration of surfactant, which is given directly into the lungs to prevent lungs from collapsing, is also one good measure in this type of condition. Antibiotic cover, like explained, can be given to prevent a secondary infection. Gentamicin can be given, penicillin. Those are some of the drugs that can be given. So we're looking at prematurity, and the main problem in prematurity is breathing due to insufficient surfactants that prevent the lung from collapsing. Right, we have looked at the treatment and the other things that are involved. So Please ensure, if you have not watched the low birth weight prematurity and post-maturity lesson, you have to watch it because this lesson was a follow-up from to that lesson about prematurity, low birth weight, and post-maturity. So we have covered prematurity today as a separate condition, and I would like to say thank you so much for listening, and I hope you can comment on the links below this video to suggest topics that you would wish covered within our pediatric series of lessons.